I'm Dr. Syed Mustafa Ashraf. I'm Senior Consultant, Department of General Medicine, Prathima Hospital, Kachigoda. Today, I would like to share a few thoughts and clear few myths and facts about the most happening and the most trending news among the whole country, rather in the whole world. That is the new variant of COVID, that is BF7 variant, that is subset of Omicron B5 variant. So it has been in the news that there has been massive increase in number of cases in China, but India in Department of Health Ministry has issued an alert regarding this dangerous virus. So I would be talking today about details of this virus, what does it do, and what sort of it and how it behaves when it suffers. As far as our country is concerned, our India has reported till now only 4 cases, 3 in Gujarat and 1 in Odisha. And all the 4 cases are stable and have recovered completely without any complications. So that's a good news for us for initially. But the thing is, the type of this BF7 variant, it is rather more potent, the Omicron variant, but the transmissibility is more than 10 times. That means a person can transmit this viral infection to more than 10 individuals. So what all the symptoms, most would be worried about what will happen if one gets infected with this strain of virus. The most important aspect of this virus would be, rather than the previous viral infections like the first COVID strain or the Delta strain, the most dangerous strain, and the later Omicron strain, patients used to have few cold, cough symptoms and respiratory symptoms with generalized weakness and all. But this symptoms is totally devoid of this. When a patient gets infected, the patient would have a mild fever, then followed by severe joint pains, and then later comes all the symptoms like severe shortness of breath. Then when examined, it might turn out to be a massive pneumonia. So this is the most anticipated symptoms. The only point of concern is, the hallmark of this virus is you will not see all those classical symptoms with the previous COVID variants, although person to person symptoms might vary. As we can see in right now at this point of time, the whole city is suffering from the common cold. It might be a few variants of COVID in the community, but those are not reported yet, so we cannot comment what kind of virus it is. So mostly we physicians, as treating them, we are treating like a common cold and patients are recovering well. So as a question and answer, I would be like to what it is, I would be talking about this thing in detail. So I have spoken to you about the new variant, and this new variant is very infective. It will spread really fast because it is in China right now. As you remember, all the new variants had the similar time, somewhere around October, November or December, and they were peaking till January, February, and later fading out in March. So it is a very crucial time for all people in the country, right from children to the adults. We need to take immediate thing in alert and take necessary precautions. And the most important thing is, again, back to basics, that is use of hand sanitizer, avoiding overcrowding and overcrowded places, and staying away from the people who are already coughing, who are not well or sick or suffering from any other disease. Simultaneously, wearing a 2-ply or 3-ply mask, a good quality mask, not a paper thin mask which will have no effect to you, that will neither provide any benefit to you. Carrying a proper medical mask with you will definitely reduce the disease transmission by more than 90%. And the most important thing is, the people who are more prone to develop this disease, who are likely to get this disease very early, are the children and the very elderly, and particularly the most working, active middle class people are likely to get. And the people who are suffering from diabetes, kidney diseases, hypertensive diseases, patients who are on steroids or related to any immunosuppressive diseases. So these patients have to take extra precaution rather than easily getting transmitting the disease. So it is high time now we start back train ourselves to those times, go back in those times, how we have taken precaution. It doesn't mean we sit at home and nothing. The work continues, but take your own precaution. It is not a point of panic, and there is nothing to panic about this virus as of now. The symptoms are mild and patients are recovering at a good pace. So the only thing is, if you don't want to get sick or get weak, or those suffering from most of the people who might have suffered, they know very well what things they go through, what symptoms they go through. So in order to prevent them, these are the preventive methods. As prevention is better than cure. So why not take prevention and get yourself protected? Because previously people who have been vaccinated, vaccination might not help. This virus will definitely affect, and it has totally neutralizing effect on the previous infection. That means it will take its new base in the human body and show its own symptoms without interference of any other antibodies in the human being. So for patients with chronic diseases and other things, they should stay at home and avoid frequent contacts with people who are actively moving, or who are rather actually suffering from even common cold also. So my dear viewers, this is an initial talk, as the whole country is going through a panic, and everyone is like in a thought of doubt, a confusion that what is going to happen next coming 2 weeks or 3 weeks. How will we see this disease? There have been a lot of things on the Facebook that many millions will die and this disease is going to be very severe and not. No. As a healthcare physician, as a senior physician, my responsibility towards the society is to create awareness about the disease. First thing, do not panic. First thing, do no harm. And give the audience, the people who are listening, convey them a message. Okay, do not panic. Take your necessary precautions. Avoid overcrowdings. Avoid handshake. Start social distancing. This will again create a good hygiene environment. As you can see, previously in a couple of months there were a lot of dengue cases reported, there were quite pneumonia cases reported, quite blood related infections, other chronic diseases were reported. But now it's a point of concern. Yes, definitely it's not the point to ease and let go and neglect, or it's like nothing will happen, it's just a trick, it's a gimmick from the business magnates that they have released this virus for their own benefit. No, this has come, and we need to take approach for our well-being as for our family as well. So as a responsible citizen of the country, you should take your own initiative in preventing this disease, so as to you can see through this tough time when cases started to, God forbid, cases start to increase, or it affects people. So my humble request and to pass on this message, and take good care of yourself, and I hope this will go in a very mild way and less people will be affected, and you will have a safe season. Take good care of your health, personal hygiene, and take all the necessary precautions which you are doing in the past. I take leave. In any case, in any emergencies or any worsening symptoms which you might feel, you can come directly and meet me in the Department of Medicine. I am Dr. Syed Mustafa, Senior Consultant Physician, General Medicine, Prathima Hospital, Kachiguda, Hyderabad. Thank you so much.